If you're in menopause or beyond, bone health might feel like a losing battle, but it doesn't have to be that way. In this video, I'm sharing the 4 most effective science-backed strategies to help you beat menopause-related bone loss. These strategies aren't just about taking supplements or doing exercises. They're about optimizing your approach to maximize your bone strength. Stay with me until the end for my ultimate bone protecting solution, something a lot of women have never even heard about that can make all the difference. Well, these are my parents. Both my parents struggle with osteoporosis. Seeing both of them go through broken bones and recovery, it's been a tough road for everybody in my family, my siblings and myself. A couple years ago, my mom fell and fractured her hip. She recovered, but she still walks with a little bit of a limp. My dad's experience has been a lot more severe. He's got both osteoporosis and sarcopenia, which is a serious muscle loss. He's fallen multiple times over the past several months. 2 nights ago, my mom called me at 12:50 a.m. Dad fell and broke his hip, took a ride in an ambulance. He's right now in the hospital recovering from a successful hip surgery yesterday. He'll be transferred to a rehab hospital in a day or two. We're not exactly sure what the future holds because Dad's severe muscle weakness makes his recovery a lot harder than my mom's was. Preventing fractures by building strong bones is what today's video is all about. We can think of supplements as the foundation for bone building efforts, but the key here is optimizing your supplements. The first supplement that automatically comes to mind is probably calcium, which I did a video about. You can aim for around 1,200 milligrams of calcium a day. Optimize your intake by combining dietary sources with supplements. Calcium citrate's better than other forms as far as absorption. Avoid calcium carbonate, it's kind of like swallowing chalk. Optimize your vitamin D levels with maybe around 1,000 international units or more of vitamin D daily. It's a great idea to test your 25 hydroxy vitamin D levels and aim for 80 to 100 nanograms per milliliter. There are a few other essential nutrients, and I've mentioned vitamin K2 in another video, but also boron, strontium, and others can play a role in healthy bones. As I talked about in that other video, supplements, especially calcium and vitamin D, aren't going to strengthen your bones by themselves. You're going to need to optimize your overall bone health strategy for those to be truly effective. Your bones are made up of about 50% protein. If you don't eat enough protein, you can't really build bones. There's been a lot of research over the past few years showing that optimizing your protein intake to between 1.2 to 1.6 grams of protein per kilogram of body weight every day helps you maintain bone density. So for a 140-pound woman, that's roughly 75 to 100 grams of protein every day. Here's what that might look like. So around 106 grams of protein in a day is pretty good. Spreading protein across 2 or 3 meals helps your body utilize that protein more effectively for both your muscles and your bones. Hitting those protein goals isn't always easy, even for me, but especially if your appetite isn't as hearty as mine is. But optimizing your protein intake is really crucial for your bones, for your muscles, and for your overall health. Exercise is really a non-negotiable when it comes to healthy bones, but it's not just about moving more, it's about optimizing your exercise routine to maximize the benefits. A study called the Lift More trial showed that high-intensity resistance training combined with weight-bearing exercises can actually increase bone density and reduce fracture risk. When we talk about weight-bearing activities, that includes things like walking and hiking and dancing or climbing stairs. All of those help to challenge your bones. Resistance training is kind of like squats and lunges and weightlifting and dumbbells. Those target both your bones and your muscles. The optimal is 2 to 3 resistance training sessions every week and include some form of weight-bearing exercise like walking every day. Optimizing your exercise routine builds stronger muscles and bones while also reducing your risk of falls at the same time by building balance. So we can think of these 2 sticks as 2 different bones, if you will. This is a fresh stick that's kind of like a healthy bone. It's dense, it's flexible, it's kind of resilient. I can't break it. This stick kind of represents an osteoporotic bone. It's much more fragile and prone to breaking, a lot easier to break. And this is kind of where your hip would break. You see, healthy bones can bend under pressure without breaking, while brittle bones fracture easily. Bone density is important, but bone resiliency matters just as much or maybe more than bone density. Calcium and vitamin D, even bone drugs like Fosamax and Actionable, those can help you get more calcium into your bones and increase bone density, but they can't really improve bone resilience all that much. That's where hormones, especially estradiol, come into play. When I talk about hormones, I'm not just talking about taking a pill or wearing a patch. I'm talking about getting to optimal hormone levels that keep your entire body functioning at its best. For building strong bones, optimal estradiol is particularly important. So this building has been about a block from our house for as long as I can remember. It started out as a bank. Later it became a bookstore, and most recently it was one of our favorite barbecue places. Sugar House Barbecue closed last summer. Ironically, it's being turned back into another bank. The building is apparently being both demolished and reconstructed at the same time. So you know why they do that with an old building like this, don't you? It's because it's got good bones. Estradiol acts sort of like the project manager. That's this guy walking around supervising the job site. He's making sure the demolition doesn't outpace the construction. Without enough estradiol, your bones can become unstable, just like Sugar House Barbecue would if it starts getting torn down faster than it's being built up. Aiming for blood estradiol levels of at least 60 to 65 picograms per milliliter, or even better, 100 picograms per milliliter, helps regulate the demolition and construction teams in your bones. Optimal estradiol levels increase bone resiliency and strength in ways that other treatments just can't touch. Well, here's a study that showed that optimal levels of estradiol significantly reduce the number of wrist fractures in postmenopausal women who had osteoporosis. The loss of estradiol at menopause is the reason. It's the root problem underneath menopause osteoporosis. So it makes sense that optimal estradiol levels are the single biggest key that unlocks bone strength, resilience, and a reduced risk of fractures. A level of testosterone above about 30 nanograms per deciliter has been shown to improve bone strength for women. Testosterone supports both muscle mass and bone strength in both men and women. Optimal thyroid hormone levels, especially one called free T3, help to prevent excessive bone turnover or bone breakdown. Working with a trained, qualified hormone specialist is really essential to help to tailor those hormone levels. Not too high and not too low, but just right. Everybody has a superpower. My superpower is boiling down complicated medical research into easy-to-understand videos, just like this one. And here's another study that showed that optimal estradiol levels were much better than bisphosphonates at increasing bone density and, more importantly, reducing broken bones. Ever do a Google search for something like osteoporosis or hormones and breast cancer? Well, unfortunately, Google's search results are jam-packed with paid advertising, misinformation, just an overwhelming number of conflicting viewpoints. If you've ever struggled with confusion from that mountain of information you get from Google about hormones and menopause, I might be able to help. I've shared the story of my mom and dad and their struggles with osteoporosis in this video. Well, I've got lots of other stories of women just like you, women who have struggled with menopause symptoms, but also the long-term health risks, like osteoporosis, that menopause can bring. These stories help you to understand two things. Number one, you're not alone. And number two, there is hope. My digital course, The Menopause Solution, is based on searches, stories, and studies. These three pillars are designed to help you make your hormone replacement therapy decision. The Menopause Solution helps you gain the clarity and confidence to take charge of your own hormones and your own health. The Menopause Solution walks you through the pros and cons of hormone replacement therapy and hormone optimization in clear, simple terms. You'll learn how to assess the real risks and the long-term benefits of hormone replacement and hormone optimization. You'll see that whether you optimize your hormones or not, you'll face risks either way. You'll gain the confidence to make your own decision about hormones, whether you choose HRT for your menopause symptoms or not. Just head over to simplehormones.com/decision to enroll. Your health and your bones are worth it. Don't wait until it's too late. Thanks so much for watching, and I'm really looking forward to seeing you inside the course.